So some of the objectives that I wanted to address this morning include some risks and facts about older adults and their mental health and mental faculties as they age, knowing some of the signs of cognitive decline, and knowing the signs of a healthy aging mind, and understanding how to maintain that healthy aging mind. So, reality or myth? Well, this isn't working quite right. But anyway, depression and loneliness are normal in older adults. And since myth came up, I guess you know that it's a myth. As people age, they find they feel isolated and alone, and that can lead to depression, anxiety, and sadness. And it is not a normal part of aging. So to be aware that addressing some of that isolation and loneliness can help to decrease the possibility of developing depression and anxiety. And older adults are less likely to share their feelings. I know when I was going through graduate school, one of the things that I was asked to do was to go and interview some older people about mental health services. And they repeatedly told me there's no way that they would go for any mental health services because they weren't crazy. So we have to still deal with a lot of stigma around mental health. The older I get, the less sleep I need. Well, that's also a myth. You may have greater difficulty falling asleep and staying asleep as you age, but the sleep need doesn't decline with age. You still need 7 to 9 hours of restful sleep a night. And that adequate sleep helps you to stay healthy and alert and mentally and cognitively functioning at your best. It improves your overall well-being by having that rest so you can heal and recharge for the next day. So, older adults can't learn new things. Has anyone heard that before? Well, this is a myth. It is not true. Older adults can still learn new things. They can create new memories. They can improve their performance and a lot of skills. Now, learning those and trying those skills may help also to improve their cognitive abilities and, to resolve questions and make decisions and things like that. And seeking those new connections and engaging in social activities can keep the brain active. And we see a lot of universities offering courses and trips to view educational things and opportunities like that to older adults, because they can still learn from all of those things. So it's inevitable that older people will get dementia. This is also a myth. Dementia is not a normal part of aging. And there are people that live into their 90s and up over 100 that are still able to think and process and converse and maintain their cognitive abilities. There may be some forgetfulness, and this is a normal aging process, but that's not necessarily dementia. So we see usually 6 types of memory loss. The absent-mindedness. Now, this is where you lose things or you forget things. And I think almost all of us run into this at times. You forget where you put the keys, or you forget something that you wanted to pick up at the grocery store. And some of these things can get more profound sometimes as people age. Another type of memory loss is blocking. Those situations where, it's on the tip of your tongue, you just can't think of it. And the answer may come to you later. Scrambling is another type of memory loss, where a person remembers, but they confuse the details. Maybe they're telling a story and they're mixing the details of two different stories together or something like that. Fading away is a type of memory loss where we think of, you use it or you lose it. This is where, a lot of word games and things like this can help to keep a person sharp. Doing the Sudoku puzzles and things like that can keep you sharp if you've dealt with numbers. Struggling for retrieval is a type of memory loss where, you can't remember the name of somebody. You were just introduced to someone and you turn around and you get ready to say something to them and you can't remember their name. Or you go to introduce them to someone else and you can't remember their name. Or back in the days when we were able to get out of our homes and actually go to a movie, you might see a great movie, but then you can't remember the title when you're going to tell someone about it. And the sixth type of normal memory loss is called muddled multitasking. And this is, as we age, it gets harder and harder to multitask, to have more things going on at a time and be functional with it. I know for myself, the last few years, I feel like I can't keep as many balls in the air as I used to. So those are normal types of memory loss. So the next statement, older adults should take it easy and avoid exercise so they don't get injured. Well, I think we've already heard from both John and Dr. Jervich this morning that exercise is an important part of staying healthy. The studies show that there's more to be gained by staying active and more to lose by sitting too much. I had a grandfather that when he retired, he went home, sat down in his recliner, and that's where he spent the next 30 years, basically. He didn't go and do anything, and his abilities really declined over that time. So physical activity can also help to manage those chronic conditions like diabetes and high blood pressure and heart disease. And they're a benefit also to that mental as well as the physical health. Now, we may have heard that if a family member has Alzheimer's disease, I'll have it too. This is a myth. The risk may be higher, but it's not an absolute. You can't absolutely say you're going to have Alzheimer's disease if you have a relative that did. Environmental factors such as exercise, diet, exposure to pollutants, which is really common when we talk about insecticides and things like this in our rural and farming communities, smoking, all of those can increase your risk of having Alzheimer's. There's nothing to be done to reduce one's risk of Alzheimer's disease and related dementia. Again, that is a myth. I'm not as good with my animations as I used to be, so they're not working quite right for me. Physical and mental inactivity, smoking, obesity, diabetes, hypertension, and depression are all associated with an increased chance of Alzheimer's. So in people that have Alzheimer's, we see more of these chronic diseases. Now, as far as Alzheimer's disease and related dementias, there are about 100 types of dementias. Something mild like, after a night on the town, you discover a note in your pocket and you don't remember anything about it. That's one of the milder types. And then there's the other extreme of irreversible fatal Alzheimer's disease. And I had an aunt and an uncle that both passed with Alzheimer's disease in the last couple of years. And, it's really a progressive and very difficult disease. There are two categories of dementias, those that can be cured and those that can't. So what are some of the warning signs of Alzheimer's? Well, first of all, memory loss. And this involves, occasional forgetting of things is normal, but frequently forgetting or unexplainable confusion may indicate something's wrong. I once heard it, that you can forget where you put your keys, but if you forget what the key is for or how you use it, that's when you've got more of a concern. Difficulty performing familiar tasks. So it's normal to occasionally get distracted, maybe leave a pot on the stove too long, but forgetting a meal while it's cooking, or if you forgot you even prepared the meal, then it's more of a problem. So, is it a nuisance or is it a problem is the kind of distinction we're looking at with all of these. Problems with language. So everybody has trouble finding the right word sometimes, but forgetting simple words or substituting inappropriate words that make the sentence where it's really hard to understand, and this may be an indication of something more severe. Disorientation to time and place. Well, it's normal to forget what day it is, especially in these times where we're at home all the time and it's just one day after another and nothing seems to change. It's hard to keep track until the weekend comes and it's like, oh, it's a different day. But those with Alzheimer's may get lost in their own neighborhood and not know how to get back home, or may forget who people are, or when they last saw them. So keeping track of those types of things. Poor or decreased judgment. Forgetting to bring a jacket or a sweater on an evening outing when it may get chilly is kind of normal, but not recognizing that it's inappropriate to wear pajamas to the store or wear several layers of shirts or pants on a hot day is more of a problem. And, again, nowadays with the pandemic and you don't have to dress like you did to go to work and things like that, some of these things have blurred a little bit. But really looking at, is this totally inappropriate or not? Changes in mood or behavior. Everyone experiences a broad range of emotions, and that's just being human. But people with Alzheimer's and related dementias experience extreme and rapid mood swings for no apparent reason. Misplacing things. Most of us at one time or another misplaced keys, a wallet, a purse, the TV remote, but leaving the TV remote in your shoe or putting your shoes in the refrigerator and not recall how they got there is more of a problem. Changes in personality. Well, a person's personality changes and develops as they age. And a person with Alzheimer's and related dementias can have dramatic and sudden changes in personality over time. That someone may be easygoing and then become angry, suspicious, and fearful all of a sudden. So recognizing those dramatic changes. Loss of initiative. It's normal to tire of housework or work or social activities, but most of the time people will return to those activities and retain their interest. With those with Alzheimer's and related dementias may remain disinterested and uninvolved, and in many or all of their usual pursuits or interests. So those are some basic warning signs of those differences. So how do we lower the odds of having Alzheimer's? Well, having a brisk walk each day, totaling 150 minutes a week can help to reduce those odds. Don't smoke. That it is a factor in many chronic diseases, but it also impacts Alzheimer's. A Mediterranean diet, one with more fruits and vegetables, lean meat, things like that, is healthier and helps reduce the odds of having Alzheimer's. And we're not saying these are cause and effect. We're saying it helps to reduce your odds. Light to moderate alcohol consumption. So not overindulging and doing something challenging for the brain, reading, writing, playing games, crosswords, Sudoku, things like that. They found that the risk of Alzheimer's decreases by 60% if you practice 4 of these ways, or by 38% if you only practice 3 of them. So you can really impact the chances of having Alzheimer's by doing some of these basic healthy things. Okay, now that I'm older, I have to give up driving. This is something we get a lot of resistance from older adults. It's a myth. The number of older adults licensed to drive will continue to increase, especially with the baby boomers. 20% of licensed drivers are over the age of 65. And changes occur like slower reaction times, diminished hearing and vision, reduced strength and mobility. Those impact their abilities to drive. So the decision should be made on ability to drive safely, not on the person's age. Now, an individual can learn new skills late in life. We talked about them continuing to learn, so this is a reality. Older adults can learn skills late in life, but it may take them longer as they age. Older adults stay engaged and productive, and that also is a reality. Many older adults continue to work, volunteer, act as caregivers much later in life. So what are some tips to make aging well a reality? Well, having good health. As John talked about, he's done these things and he's maintained his good health and doesn't have a lot of the problems that end up making a person more feeble and frail. Getting exercise gets the blood flowing. It helps overall in your health, but it also helps your cognitive abilities by getting the oxygen to your brain. Developing having a healthy lifestyle, not just developing it as you're older, but setting up now and continuing a healthy lifestyle through your life can really make you age well. Doing the preventative health practices, get those preventative health exams and maintain all of those things that that dental care is a big one. Seeing your physician, following up on your colonoscopies and your mammographies and all of those types of things are preventive health practices that really can help you age well. Advocate for your health. As John talked about, his wife is a nurse. She takes all the Medicaid and Medicare cards and insurance cards, Social Security, all of those types of things, and keeps track of those. Putting all of those together to where you have someone that maybe goes along with you to those health appointments, and if something's not clear, asking for clarification from the doctor, being able to go in and say, no, they need to be seen today. This isn't something that can be put off for 2 weeks. Someone that's going to help you be able to do those things. Recognize and treat mental health the same as healthcare. Mental health impacts probably 80% of physical health issues. And so the better you can keep your mental health, the better you will be overall. Stay involved and interested in art, sciences, culture, politics, social activities. As you heard John talking about, he still stays involved with things, and even though he's retired, that's an important thing in stimulating your cognitive processes and your thinking and all of those issues to help keep you mentally sound. And engage in what matters to you. Is it politics? Is it social activities? Is it something with your church? Is it cultural activities? Whatever it is, stay involved, stay active, continue to practice those things, and you'll age well. So how do we improve brain health and avoid cognitive problems? Well, practicing memory training techniques. Focus on paying attention so that your mind doesn't just wander, or you don't just, check out. Frame, creating visual images and mental associations with things. When you're introduced to someone, associate that name with something. For example, if someone's named Jack, maybe you could think of playing jacks as a kid, or playing cards with your friends and seeing that Jack come up in the cards in your hand, things like that. Other examples, doing crossword puzzles. Now, I'm not one that can do those in pen. I still use a pencil so I can erase, but it helps to keep the mind sharp. Sudoku, math puzzles, to help, again, making those cognitive connections, letting those neurons fire so that they get some exercise. Trivial Pursuit. Elders are really great with that, especially if it deals with things that are go back in their history that they can remember. Remembering the grocery list, practicing that so that you remember when you go to get the groceries what you're looking for. Learning new things, whether it's taking a class or whether it's doing something or finding something you want to do on YouTube and learning it from there. So John talked about he has this computer and he surfs the internet. Well, you can find a lot of things out there. So, thinking about how you might do some of those searches. And as I said, taking a class is a really good way to learn something new. So reducing stress. Take relaxation breaks throughout the day. Stretching, meditation, conversations with friends. The Wheel of Fortune games during the breaks are ways to keep our mind thinking, challenging us to, okay, finish the puzzle. What word goes in there? Other examples include yoga, exercise, Tai Chi, getting that restful sleep, cutting back on your multitasking, stay focused on one or two things. Lighten your load, hand off some of those things that you have to do, allow someone else to help you or be able to get someone in to help you. It's really hard, especially if you've been very independent, to ask for help, and it takes practice. So thinking of ways that, you can lighten your load by asking someone, and it can be a blessing to them to be able to step in and do something for you. Laugh. Humor is wonderful. Finding ways to laugh and joke and find humor in situations. Getting organized and having things laid out so that you know where they are and it makes sense to you. And then again, asking for help, which is another challenge for many of us, is learning to ask when we need help. Get enough sleep. As I said earlier, that sleep helps the brain heal. And we have less amyloid plaque developing, which is related to Alzheimer's, less inflammation in the brain. So it helps to keep the brain healthier. Treasure your sleep. It's your friend. And then exercise regularly. Your hippocampus is a memory center of your brain, and it will grow when you exercise regularly. And a bigger brain is better.